Pregnancy is a really exciting time for women and their families, but it does put an extra physical stress on the body, and sometimes this can lead to medical complications. Gestational diabetes is when diabetes is diagnosed in pregnancy and resolves immediately after your baby is born. There are a number of risk factors for gestational diabetes, and when you see your midwife at the beginning of pregnancy, she will have a look and see whether you are at risk of gestational diabetes and recommend that you have a blood test between 24 and 28 weeks to see whether you have gestational diabetes. The risk factors for gestational diabetes are if you've had previous gestational diabetes, if you've had a previous big baby, and that's a baby over 4.5 kilos, and that's around 10 pounds. If you have a family history of diabetes in a first-degree relative, so that's your mum or your dad or your brothers or your sisters. If you are from an ethnicity with a high prevalence of type 2 diabetes, so that's women from the Middle East, from South Asia, from Southeast Asia, Afro-Caribbean women and women from North Africa. And also if your body mass index is more than 30 kilograms per metre squared. If you have any of these risk factors, you'll be recommended to have a test for gestational diabetes during pregnancy. So gestational diabetes is important to pick up because it's important to regulate your blood glucose to make sure that you and baby remain healthy. If your blood glucose is very high, the baby tends to grow too much and get too big, and then clearly there are going to be some complications related to having a very big baby. Most obviously, the chances of you having caesarean section can increase or having a traumatic delivery. Your obstetricians will recommend the best mode of delivery for you depending on the size of the baby and how well your diabetes is controlled towards the end of your pregnancy. If you've had gestational diabetes, you do have an increased chance of type 2 diabetes in later life. Therefore, it's very important to maintain a healthy weight to help reduce the chances of type 2 diabetes, and also to get checked at your GPs every year to check that you don't have type 2 diabetes. There are several options for treating gestational diabetes. This includes dietary modification, physical activity, maintaining a healthy weight, and also pharmacological treatment in the form of tablets or even insulin therapy. And these will be discussed with your doctor and your midwife at your clinic appointment. You can find out more about these options later in this online programme.